Hi, my name is Junseok Lee. I'm fourth year Korean medical student of Pusan National University. This presentation is about tuna manual therapy versus usual care for patients with non-specific chronic neck pain. Neck pain is the second most common musculoskeletal disease after low back pain, and 2/3 of adults experience neck pain at least once in their lifetime. Tuna manual therapy is a type of therapy that manipulates a specific part of the body, sometimes with the aid of equipment. It was developed based on the traditional tuna techniques combined with a theoretical basis in Korean medicine. Pragmatic clinical trials aim at providing support for clinical or policy decisions by providing the basis for selecting interventions in real-world clinical practice. Since there are no well-designed pragmatic clinical studies applying tuna manual therapy to chronic neck pain, the authors evaluated whether tuna manual therapy is more effective and safer than usual care in conventional medicine. The study was a parallel, two-armed, assessor-blinded, pragmatic randomized clinical trial. It was conducted at 4 spinal specialty hospitals and 1 academic Korean medicine hospital between October 18, 2017 and June 28, 2019. 108 patients were recruited. They were allocated to the tuna group and the usual care group in a 1-to-1 ratio. Both groups underwent 10 treatment sessions. Tuna technique was selected by physician clinical judgment, examination, physical test results, and imaging data. Usual care group was provided with oral medication and electrotherapy. To accurately reflect the clinical environment of Korea, the list of most frequently used drugs and physical therapy treatments for neck pain, herniated cervical disc, cervical sprain was provided as a reference to the usual group treatment. Acetaminophen up to 4 grams per day was allowed as a rescue drug, and every treatments were recorded. Authors used visual analog scale, numeral rating score for pain, neck disability index, Northwick Park neck pain questionnaire, patient global impression of change for functional condition, European quality of life, 5 dimensions, 5 levels for quality of life. These were measured by blinded investigators. The group had no significant differences in baseline characteristics. At the primary endpoint of week 5, the tuna group showed significantly superior effectiveness for all pain outcomes, function, and quality of life. At the 1-year follow-up, tuna group continued to show superior effectiveness for the chronic neck pain NRS, NPQ, NDI, PGIC, WPAI, SPH scores, EQ5, D5L scores. In the analysis of the cumulative values of each outcome at 1 year based on the area under curves, the tuna group showed significantly superior outcomes for the chronic neck pain NRS, NPQ, NDI, and EQ5, D5L. But there were no differences between the groups in terms of the radiating pain NRS and SF12 scores. In the graph, dots are mean NRS scores. As you can see, area under curve of the tuna group is much smaller than the usual care group. Also, the tuna group showed a more rapid rate of recovery, and this difference was maintained at the 1-year follow-up. As you can see in the 2 graphs, cumulative incidence of recovery in terms of pain is higher in the tuna group than the usual care group. The authors determined that extent of recovery, 1-year maintenance, faster rate of recovery, cumulative pain or function improvement are the most clinically important factors in neck pain. Tuna manual therapy showed positive results for these factors compared with usual care in terms of improved pain relief, function, and quality of life outcomes at week 5 and 1 year after randomization, and a faster rate of recovery resulting in better cumulative values after 1 year. Previous studies mostly involved patients with subacute pain, but in this study, all patients had chronic neck pain and a mean disease duration of 4 years. It is worth noting that more than half of the patients had no medical usage within the last 3 months, possibly because of no particular improvement from previous usual care, and showed higher preference for tuna manual therapy. Lastly, there were no severe adverse effects in the tuna group. The strength of this study was the fact that it is a pragmatic study that reflects real-world clinical practice with an intent of enhancing the external validity. However, there were some limitations. The authors could not implement a double-blind study. Pain is a subjective variable, making it difficult to measure objectively. The list of the most frequently used drugs provided to the usual care group might have limited the treatment. There was an error in one question in the SF-12 in the initial case report form, which could also be a limitation to the study. In conclusion, tuna manual therapy is a safe and effective treatment strategy. The authors anticipate the study results will contribute to health policy decisions regarding neck pain and determining the level of evidence and recommendation grades in the Korean medicine clinical practice guidelines for neck pain. This is the end of the presentation, and thank you for your attention.